Hi everyone, I'm Tomike and welcome back to The Power to Prevent. So this is where we talk about HIV, how to prevent it, and how those prevention methods can change lives. So this is under the BHA for Equality and their PrEP project. It's a limited series where we bring on different guests to share their perspective of what PrEP is and how it can help different communities. To explain a little bit more about PrEP at the PrEP project and the BHA, we have Meg, who's actually the leader of the PrEP project for the BHA, and she can give us a bit more detail into that.
Yeah, hi. So I'm Meg. I'm a sexual health lead at BHA, and the PrEP project is a project to increase awareness, access, and uptake of PrEP in Black, Asian, and minoritised ethnic groups. So we're doing this through a series of different tailored interventions. Some of those look like group sessions in the community. We have like a PrEP women's empowerment sessions where we're creating educational awareness around PrEP for women and how it can empower women's sexual health. And another way we're doing this is through our fast track system. So we have a system with the Northern Sexual Health Clinic where we can fast track anyone from a minoritized ethnic group, and we can make that process of getting PrEP quicker for them so they can get an appointment with the Northern and get onto PrEP quicker and easier as well. So there's lots of different ways we're doing that. Again, through the podcast as well, like you're saying, just increasing that awareness, I think, of PrEP and word of mouth to hopefully start bringing in that access in different communities.
Thank you so much, Meg. So, like I said, Meg is the leader of the PrEP project for the BHA, and this podcast was actually her idea. So it's really nice to have you on as well and just talking about PrEP. Again, like you say, increasing word of mouth, normalizing those conversations the same
Mhm.
way you would contraception, the same way you would condoms. And yeah, so it's really nice to have you on today. And
Okay.
also, our other guest on today is Tihesia. You might have heard her as SheTalks. She has her own online platform and social media. And would you like to give yourself a little introduction?
Hi, thank you so much for having me on today. I'm super excited for this podcast. I'm Taisha. I'm a resident doctor, currently working in sexual and reproductive health as a trust grade doctor in Southwest London. And as Tommy Kay said, I created the She Talks platform about 5 years ago now,
Wow.
something like that, where I share information, infographics, videos about sexual and reproductive health, and also my experience living with endometriosis as well. That's what I spend my time doing.
How did you get into sexual health? Like, how did your interest begin?
Yeah, so my interest began when I was a third year medical student. I had a really amazing student selected placement where I was lucky enough to spend about, I think it was about 12 weeks in sexual health, which is really, really rare as a medical student. Um, so I was doing an audit, and my supervisor really got me hands in and involved in doing consultations, speaking to patients, doing contraception. STIs, symptomatic screens, that sort of thing. And I just fell in love with it then, and have not looked back since. I think I just enjoy how patient facing it is, how much time you get to spend with patients, and the sort of work that you guys are doing as well. So community work, there's so much community work to do with sexual health and advocacy, and education as well. One thing that I love about my job at the moment is that every consultation feels like an opportunity for education. Um, Even if it's something really, really small, like, you know, you don't have to use crafted soaps to wash your vulva with, things right up to, someone that's never heard about PrEP and starting them on PrEP in the same consultation. It's really varied. Absolutely love my job, and I'm hoping to specialize in it in the future.
Thank you. And I think it's really interesting that you talk about the education aspect of it because I think when you're like, as a patient anyway, when you're a patient in a doctor's office, you don't often get that level of education, obviously because, you know, consultation times are very short nowadays and things like that. So I think it's really nice and refreshing to hear you say you take the time to like explain little maybe misinformations or misunderstandings, because it's not something that most doctors have in the forefront of their mind, understandably so, but still.
I think we're really, really lucky in sexual health that quite often we have more time than someone would in a general practice setting. So GPs will get like 10 minutes and our consultations are at least 30 minutes.
Yeah.
And in my clinic in particular, we have like one list sort of function. So if I'm with a patient for longer, someone else is picking up patients. And like if my patients are quite quick, that means that someone that needs a bit of extra time can spend that extra time. I've spent up to an hour, hour and a half with a patient sometimes. And we're lucky to be able to do that.
And it's a big difference, isn't it, between that, you know, that 10 minutes and what you can get out of that. And I think that is so important for people to know as well, that when they come into the clinic, you know, there isn't the same rush that it might be when you're in the GP, and that you can take that time to ask all the little questions you might not ask because, you know, like you say, the fact that you can even go over that half an hour, I didn't know that, and that's amazing.
That's in
And
our clinic. I'm hoping it's similar.
yeah,
Like
yeah,
other places might have one list, but I might
yeah.
not have one list. But we're quite lucky where I am.
Yeah, I think that's great. And like you say, when there is that more time to have a detailed conversation, you're hearing new misconceptions and new things that you've never heard before. There's always different things. And I think that's so interesting. That gives you such a interesting perspective on, you know, something like prep. It's you're hearing all new different things every day, I imagine.
Yeah.
I just want to ask for the listeners that maybe haven't tuned in before or don't even have any contact with the BHA or things like that. Could you explain a bit more about what PrEP is and how it's helpful?
Who wants
Yeah,
to?
so
Yeah.
so PrEP is a pill that can prevent HIV. It's an amazing medication. It's in terms of insects, it's about 99% effective in preventing the acquisition of HIV. You can take it with different dosing methods, so we can go into that in a bit more detail. But yeah, PrEP is relatively new to most people. Not a lot of people have heard about it, and then when they do, it's kind of like, wow, I didn't even know this existed, that you can take something that actually prevents HIV, you know, other than other ways of contraception. And so one of the methods you can take PrEP is through daily dosing. So you would take a PrEP pill once a day. And as I say, you would then have that built up prevention of HIV. Then there's other methods, so events-based dosing, which is taking PrEP around the times that you need it. And there's different ways to do that based on what kind of sex that you're having. I don't know if you want to add to that, Taisha.
Yeah, no, that's a perfect explanation. So you've spoken about daily dosing, events-based dosing, and really it's for anyone that is at risk of HIV. So I think when it first came out, there were a lot more sort of eligibility criteria and things like that. But there's new guidelines that are out that it is a lot more if someone feels that they are at risk of HIV, then you can pop into a clinic and have a discussion about PrEP. And it's quite safe to take. And, you know, if it's not working for someone in terms of some of the side effects or anything like that, there are always things that we can do as well. So it's not just sort of like you try it once and there's nothing else that can be done if it's not the right fit for you. There are other versions of it, and things like that that can be done, or changing the dosing. For example, if you're on daily, maybe changing to events-based, things that can help for people to stay on it and you know enjoy their time having PrEP.
And Taisha, I think one of the reasons we were really excited to have you on is because you had, like again, like I said, a very interesting view as a clinician. So in that kind of perspective, what have you seen of the general attitudes of PrEP and PEP? Like, what do people think about them when they first are either introduced to the idea, or maybe they come in asking about it?
I think it really, really varies. So you have people that have heard a little bit about it, know what it can do, and are really, really super keen to start on it. And that's great. And you're able to just sort of run through the consultation, explain bits and bobs, and they're happy to go on it. And then you have some more sometimes more challenging consultations where people might have some misconceptions about it. For example, one thing that I heard was that someone had some concurrent side effects that we didn't think were related to PrEP. And they thought that it was possible that we were giving this medication to people to in turn prevent them from having unprotected sexual experiences. So some misconceptions and things like that that you sometimes have to guide people around. Um, I think in general, where I am, we have quite good uptake of PrEP, but I think there are groups that are missing out on PrEP and groups that maybe are not offered PrEP because of misconceptions that they might not need PrEP. So particularly women and commercial sex workers and ethnic minority women in particular, so Black women. So some people that may not feel that they need PrEP or might not have been offered PrEP in the past, those can be sort of different consultations that might need a bit more counselling around. And sometimes it's more than one consultation. We can give people leaflets and things like that, and they can have a think and do some reading and pop back. Whereas some people, it's like a one-stop shop type consultation. So I think it varies between people that are aware of it and want to be on it straight away, and people that are a bit more hesitant or have heard of misconceptions or have that sort of mistrust of healthcare and might need a bit more time or might actually end up declining PrEP.
Okay, and I think it's really interesting how you talk about like some people might need more time
Mm.
to, so they might need a leaflet and then go home, read over it, and come back. And usually when that happens, do you see a complete turnaround, or do you, like, obviously it could vary from person to person. Do you still see that kind of hesitancy with maybe some stigma attached, or yeah,
I think it's challenging because I don't always see the same person again.
okay,
But from when I have, it will be like, oh, we discussed PrEP last time. What are your thoughts on that? And it's like, oh, like, don't think I need it, or like, don't think
okay.
it for me. So sometimes it there is still that hesitancy, and everyone has personal preference and personal choices. And we as clinicians respect that. All that we can do is give the information and make sure that they're making an informed decision. It's similar to when I do contraception consultations, and someone will say, what's the best method? Like, what should I be on? And I say the best method is what's best for you. It's really individual. If someone doesn't feel like they're going to take PrEP consistently or doesn't feel like they will take it, it might not be that it's the best method for them at that point, and it might then lead to them thinking they're protected and maybe not being tested and that sort of thing. So it needs to be an informed decision with the clinician, with them. Whereas some people we do have a complete turnaround, and they come in and they're like, yeah, thought it over, I'm happy to start on it. And we're able to facilitate them through doing that, which is super, super straightforward.
And I think, Meg, you also see people in like that kind of capacity being sexual health lead. There's
Mm.
a lot of outreach within the community. So can you also speak to what she said? And is that like the same types of interactions you have in your outreach?
Yeah, definitely. And I think, for a lot of the time, if we are doing community-based outreach, we might be speaking to people who don't always access the sexual health clinic or who have never accessed it. And so what you've got is probably I guess a different level of education around prep. And for anyone, if something's new, then you don't trust it. That's just how it goes. Nobody wants to, I guess, put something in their body that they don't understand. And so I think that comes into it massively is, like I said earlier about the word of mouth, speaking to different people in the community who are then able to pass on that message. But I think, while saying that, there's definitely a buzz around prep in terms of when people haven't heard about it and then they do find out how effective it is, and how many people use it as well. I think there's an excitement around that for a lot of people who have anxiety around the sex that they're having, or they are a community that's maybe more at risk, or they've been told that they're more at risk. Um, there is something relieving in that, and empowering. And I think the thing is about prep, like you said about different ways of contraception. It's something that's very individual. It's something that you can choose to take, and therefore you know how you're protecting yourself. And I think that that's definitely something that I pick up in the community is that okay, I can have control over this. Nobody necessarily needs to know that I'm on prep. It's just something that I take that's for me, and therefore, going into sex, whether it's protected or unprotected, I know that I'm protected from HIV. And so, yeah, I think whilst there is definitely mistrust, understandably so, because it's new to a lot of people, I think there's also excitement around it. And I think there's also a realization that actually this is really empowering and it could be something that it works well for many people.
Yeah. Yeah, I definitely agree. I see a lot of people that are like shocked that it's something that
Mm,
exists. I have a lot of consultations where obviously a routine sexual health screen, as you guys know, will be chlamydia, gonorrhea, HIV, syphilis. And I always get the question with HIV and syphilis that, oh, I don't feel like I need that. And then you give them, why don't you feel like you need that? And misconceptions come up there as well about HIV and who feels that they are at risk. And I always say, if you've been sexually active and you've had unprotected sex, it's best to have a test because it can be asymptomatic for a long time.
mm,
And people often then sort of can express feelings of fear or not wanting to know. And people don't know about you as you. So, taking medication so that the amount of virus in the blood is undetectable and it can't be passed on. And I think that's similar as well with the excitement around PrEP that, like, oh, like we can prevent this from happening. So it's a really nice feeling, I think, as a clinician that you probably feel as well, Meg, when
mm.
you start from someone who doesn't know what PrEP is. It's maybe got some hesitancy, and then you've explained a bit and said how effective it is, and then they're actually considering or are started on PrEP. Like it is, it's a amazing sort of transition to see.
Yeah.
Yeah.
Yeah, absolutely. And I think, it's refreshing as well to hear that those conversations are happening in the clinics. And as we know, there was a perception of PrEP, and we spoke about this last time, but there was a perception of PrEP from the get-go that it was only for specific communities. And I think that that does still lie, in the impact trials, for example, like only 3% of the participants, so the PrEP trials, were Black African or Black Caribbean. And I think from the get-go, that created a sort of narrative that PrEP was for white, gay, and bisexual men who are having sex with men. And whether that has an impact on things now or not, I don't know. But I do think that those initial conversations about PrEP are very important in how they create narratives around it. And so I think, like you say, it is refreshing to hear that actually, if you're interested in PrEP, you can just approach your clinic, or whether you go through somebody like BHA or you come to someone like yourself, and that is possible, and that conversation is there for you to have, and no matter who you are. So yeah, I think it's exciting, and it's nice to hear that people can do that, and actually that process theoretically should be easy for them. So yeah.
Yeah.
And it's good that you bring up the fact that in the trials there's only 3% that were Black
Mm,
African, Black Caribbean, because then like it's like you said, it kind of sets this tone of it's not for us, it's not for you. And that might be to do why I remember you saying that, when you don't hear about something, you don't really trust it. And so that's why word of mouth is really important when it comes to
yeah.
things like PrEP, just to normalize the conversation. But do either of you, this is a question to either of you, do you think that there's anything else we can do apart from word of mouth to kind of normalize that conversation within, non-white communities, and even just like where spaces where it's predominantly women or females and things like that, because for so long PrEP has been targeted towards men who have sex with men. So how can we increase uptake and open up that conversation there?
Mm. I think it's everyone's responsibility, really. Um, I think from a clinical perspective, it's really important for healthcare professionals and leadership within sexual health clinics to find ways of engaging communities that have lower uptake of PrEP. So that should mean actively going out to these communities, approaching these communities, and finding it needs to be an equal exchange. So it shouldn't be just collecting information. It needs to be, what can we do to help facilitate you get the care that you need, and really listening to what barriers that they face coming into clinic or accessing PrEP. Or maybe clinic's not the best place. Maybe it is something like BHA's fast track service. Maybe it is something like that. But finding what, like building the solutions together, basically, instead of sort of just it flying under the radar, or creating strategies within your own team that you think might work. It's always best to hear from the people that are facing the barriers. I think that that needs to be a bit more of a thing, more sort of engagement with communities, finding out what can be done to help, and then equally as well from community perspectives, what organizations like BHA are doing is so important. I think going out into the community, having these education settings, because I think it's always one thing speaking to a clinician and then speaking to someone that it almost takes away that mistrust a little bit. Like, I think it can feel like I think sometimes it can feel like there's an ulterior motive, when there's that patient clinician dynamic, like speaking to members of my family, like my dad, like he's very anti medicine, which can be something that's quite prominent in minoritized communities, and scares around big pharma and that sort of thing. So I think sometimes if we take away that and it's coming from another member of a community, where it feels like there's not that ulterior motive and it's just education, and you're not going to be forced to start something on the same day or anything like that, where it feels like less pressure and there's more time. I think that's really important as well. So I think it's a multi-pronged approach.
Mm.
I don't think one singular method is going to help. I think it needs to be everyone together from all of these different perspectives. Because like you said earlier, Meg, as well, there's people that don't come into clinic. So it needs to be that we're finding out from people in their best environment, about how we can help.
Mm. Yeah, absolutely. Yeah, I think you've hit the nail on the head there. There's not sort of one way that you can go about it. I think you look initially maybe at what kind of structural barriers are there for people. When we're putting out information about PrEP, is it in accessible languages? Are we, are we tailoring our resources and the information that we're giving out? And then, like you say, actually going into communities not with an expectation of getting something out of it, but with an expectation of delivering education. And particularly when there's those trusted relationships there, that's why it's so important for us at BHA, for example, to work with clinicians to ensure that we've both got equal, understanding of different communities, of what might be a barrier to come into the clinic might therefore you might want to come to BHA and speak to us and get tested with us. Or it might be something where we can fast track you into the clinic. So I think, like you say, there's lots of different ways we can do that. And with the prep project, the different sessions and things we've been doing. I know you mentioned about women, Tomike, is that we've had the prep women's empowerment sessions. So rather than going in with the information about prep directly, we've spoken about prep as a way that is empowering for women. So understanding how women feel that they can empower themselves, what tools do they use, how do they relate to each other about that, and then bringing in how HIV prevention can relate to that empowerment. That's been a really huge success because I think it's a way of understanding prep on an everyday perspective. It's not just something that we can only think about in conversations about HIV and sexual health. It's something we can think about as like a very individual route to empowering yourself, having a tool that where you understand and control things about your own body. And so maybe shifting narratives around sexual health, allowing us to like kind of Trojan horse it a little bit and bring in other topics that people can relate to if they do have that anxiety about speaking about sexual health, immediately and very openly. So yeah, I completely agree with what you're saying. It has to be lots of different things coming from all directions, for sure. Yeah.
Yeah. And I think it's really easy to feel like I spend 5 days a week talking about sexual health, and that's normal for me. And I'm probably quite desensitized to how vulnerable it feels talking about sexual health. So I think sometimes we have to put ourselves in the other perspective as well, that if you're not used to talking about your sexual health and you've always been told that it's taboo and it's stigmatized and HIV is really scary, and you've had all of these sorts of thoughts and ideas put on you throughout your life, and now you're being asked to spend an hour just talking about that, that's probably really uncomfortable to do. So I think things like the women's empowerment group, I think that's really important to give those other perspectives and make it tie in the other themes that go into sexual health, because empowerment, autonomy, consent, they're all really important underlying themes in sexual health, and putting those and associating with other things that people will experience to do with those topics, just to make it a bit easier to talk about. Because I think it can be quite hard if you're not used to talking about that all the time.
Yeah, and I think it opens up conversations about what barriers you might have. They might be barriers that you don't necessarily see to sexual health directly, but as you talk about it, they become okay, so why is it that I don't have time in the evening to find out information about this? It's because I've got to cook food, it's because I've got children, it's because I work. It's all of these things that might make things more difficult potentially for women in particular. When we were having the sessions, it was, what do you think is a barrier to your empowerment? And all of a sudden, it was like, okay, there's a parallel here between your individual empowerment. So whether that's, I don't know, spending time with your friends or taking up a new hobby, and or having, understanding your body more, and whatever it is, all of a sudden you realize, okay, those are actually barriers that must come into place with sexual health and with accessing something like PrEP, whether it's time or money or, worrying about how much it costs and things like that. And I think that becomes very clear, doesn't it, that those things are very similar.
Mm.
And so just having a conversation about something that's slightly different actually is quite the same.
Yeah.
I'm really, really happy you guys brought up this topic of like empowerment, because that was actually my next question. Because I was gonna ask, both of you have seen people through their journeys of maybe not knowing about prep or not wanting to take it, and then maybe starting to consider it and then taking it. So, like we said, the podcast is called Power to Prevent because, like you both say, there is empowerment within taking this medication. You know, it's something, like you said, Meg, it's something you can do to protect yourself. It's your bodily autonomy. It's something that is very personal and individual to you, because even if no one knows, like you said, you know that you are protected because of this action you're taking for yourself. So I just want to ask, how have you seen, or how do you imagine that this medication changes people's lives, or changes how they might think about their own sexual health or physical health or mental health? Like, what has been the effect of prep on the people that you've worked with?
I think that I've seen people's internal like felt stigma of HIV, of sexual health testing, of coming to the clinic just drop, which is amazing. Um, because we quite often will see people, every 3 to 6 months for regular testing or another prescription of PrEP. It sort of normalizes just coming into the clinic for a check. So I think that's one thing. I think also it then allows them to have conversations with partners as well, about testing and HIV status and PrEP. And I think like we've said, I think it puts the power back into your own hands as well, so that you're making informed and safe choices about your sexual health. So yeah, I've seen people um, feel less stigmatized and more empowered and just more in control of their sexual health.
Mm. Yeah, yeah, I'd definitely echo that. I think that what PrEP does is it changes how we view HIV in terms of, okay, this is actually preventable. And especially if you've had, a perspective on HIV of what a lot of people do. I mean, it's changing, of course, which is amazing, but a lot of us still hold that stigma around HIV. And so actually seeing it as this thing that we can just completely prevent. It's absolutely possible that we can do that. And PrEP is like an amazing tool in doing that. I think is, like I said earlier, exciting for people, but also you can almost see that shift in, okay, I previously thought getting, even an understanding about what it means to live with HIV, I think changes based on PrEP. And I think PrEP can take some of that focus away from people who are living with HIV, because it's not just their responsibility to have undetectable levels of HIV. And of course, people do that beyond that medication and get to that point. But it's also our responsibility to take PrEP or to ensure our own sexual health empowerment. It's not just the responsibility of people living with HIV to do that. So I think that's a key thing as well. And like you say, again, what impact can that have, I think, on public health in general of relieving those anxieties around HIV, relieving those anxieties around sex and sex that you might see as shameful or sex that you might see as having stigma attached to it. All of a sudden, we have this thing that's like, okay, you can take a pill every day or not even every day, and if you're taking it events-based, and that can completely shift your anxieties and feelings around sex. So
Yeah.
yeah, completely, exactly what you were saying. It's so important, and I think it's like it can be really liberatory for people as well. It can be sort of life changing because it's something that they have such anxiety around sometimes, around like having sex with different people or different types of sex can be so anxiety provoking for people, and all of a sudden it's like, oh, that doesn't need to exist because that can be easily prevented.
Yeah.
Yeah.
I think as well for women in particular, there's a lot of stigma in terms of being confident about your sexuality, or I don't know, just women are not always encouraged to like engage with their sexual side, or there's a lot of stigma about women who enjoy sex. So I think being able to turn that around and have that empowerment and take that control back, I think that can be quite life-changing
Yeah.
as well. So I think that's why it's so important that things like this exist to encourage groups that are not often seen or included in the conversation about HIV and PrEP to be encouraged to think about what their risk is and to get information from reliable sources to find out whether PrEP would be something that would be helpful for them.
Thank you both. I think those are really good like messages to end on, just because I think often when we talk about sexual health and when we talk about PrEP, we just kind of talk about the mechanics of it, like, oh, take this and it will prevent this, or take this and it will stop you getting this. But I think there's so much more to it. And in terms of when we say we want to increase word of mouth, we want to increase like the normality of the situation, tying it into things like empowerment and like, even the social responsibility that it's not just on people with HIV, it's everyone's responsibility to prevent the spread, and this is how we can do it. I think it makes it a lot more relatable to talk about, otherwise it kind of sounds very clinical and very black and white, but there's so much to it and there's so much color to it. So I really appreciate you guys talking about it in that manner. And unfortunately, we've come to the ending of this episode, but I do want to thank you both for just coming on and giving your perspectives and giving your thoughts, because they are really valued, and you guys have such an interesting position being in the community, being within the clinical side of things. And I think, like you both said, you need both in order to increase uptake, to get people talking about it. So yeah, thank you guys so much for coming on. And before we wrap up, I just want to know if you guys have any final thoughts or takeaways or messages to the people listening.
I think I would say, interesting final thoughts. I think just echoing everything that we've said, and um, just generally thinking about your sexual health, get tested. Um, you don't always have to come to a clinic. There are amazing things like VHA, where you can get tested and have these conversations. And there's lots of resources online as well. So SheTalks is an amazing resource. Shameless self-plug.
Yeah.
But lots of other as well online spaces and resources where if you don't feel comfortable yet to come in and have a chat, have a read online, and then come armed with information. And I'm sure some lovely clinician or someone from the BHA would be happy to have a chat with you about PrEP and answer any questions that you have.
Yeah, definitely. I think I would say the same. So, if you're not going to a clinic, if you're not accessing a service, there's so much information, like Instagram pages like SheTalks. If you want a different way of consuming information, you can do that. And whether that's on Instagram, watching YouTube videos, there's a whole load of stuff out there. But also when you do come to access services, so for example, if you do want to come to the BHA and book an appointment with us, you don't have to do anything. We have these sort of very open consultations where you can come ask any questions, no question is silly or anything like that. And obviously, we encourage people to get tested. But at the same time, if you just wanted to come just to chat to somebody and speak to them about any concerns you might have, then you're always welcome to do that as well. And of course, we have the fast track, so we can make that process of getting PrEP easier and quicker, hopefully, for people as well. So we're really keen for people to use that service.
Thank you guys. And just to echo what they both said, use those online resources, go to the clinics, go to communities like community groups like BHA. I think there are so many avenues for people to learn more about PrEP and take their health into their hands. And then also, just as you know, be champions of your community. Talk about, once you learn what you learn about, talk about with your friends, with your family. It helps more than you could realize. And yeah, thank you guys both for coming on today.
Thank you.
Thank
And
you for having me.
yeah, and hopefully we see all you listeners in the next episode. So that's all for today.